It can be embarrassing to talk about and extremely painful.
A potentially debilitating disease that affects more than 1 million Americans, mostly women. Only on CBS 46 News tonight, Jennifer Merrily introduces us to a condition most people have never heard of until after they're diagnosed. It's a story you'll only see here.
Kim Waite spends most of her days at home in pain.
Pelvic pain, a lot of burning, urgency, frequency, like a bladder infection.
The 43-year-old used to have a career, run her daughter to soccer practice, be what she calls a normal working mother. That is until she underwent surgery after surgery.
I've actually had 16 abdominal surgeries, including a hysterectomy.
Waits was misdiagnosed by doctors for 20 years. She has a condition called Interstitial Cystitis, also referred to as IC, or painful bladder syndrome.
It's debilitating. I mean, there are days that I can't get out of bed.
IC is a condition in which the lining of the bladder breaks down, and you have holes, ulcers, lesions, or hemorrhages on the bladder lining.
This would be a normal bladder, unaffected, no disease, no interstitial cystitis. And then this would be a bladder with interstitial cystitis. You can see the bleeding and the hemorrhages.
How are things going?
It's going well. I'm following my diet.
Waits goes to Dr. Denise Peck's office in Lawrenceville for treatment.
They say that a typical IC patient sees 5 physicians over a 5-year period before the diagnosis.
A late diagnosis can be dangerous because the longer left untreated, the more excruciating the pain becomes.
They hide it. Patients overcompensate for going to the bathroom 20, 30 times a day.
Who gets it?
It can be anybody. It can be anybody. It can be any age, any ethnicity.
Research shows 90% of patients diagnosed are women.
Yeah, with installations.
Women like Kim Waite, who has an extreme case.
How has having IC changed your life?
It's changed most everything about my life. If you have to change your diet, you have to change the way you do things.
Her hope is that IC will become a more common diagnosis so that other women don't suffer the way she has.
If you feel like something just isn't right with your body, just don't stop. Keep pushing. I should have asked more questions. I should have pushed harder, and maybe they would have found it earlier.
If caught early, IC can be managed through diet. So far, doctors and researchers have not been able to determine why some people suffer from IC and others don't. For more information on IC, go to CBS46.com. Jennifer Merrily, CBS 46 News.
That all-important diet there.
No kidding.
Another good
Dagmar joins us now.